Hi, ladies and gentlemen. Welcome to another edition of the Cameroon Town Hall for Healthcare Professionals. If you are joining us for the first time, this is a platform that brings together healthcare professionals from Cameroon origin who are spread all around the globe, now from about 34 countries. We started this platform more than almost getting to 2 years now, and we meet every fortnight to talk about health issues that can that impacts the life of our people back home. And so this platform is made up of medical doctors, nurses, lab technicians, midwives, scientists, public health experts, everyone who is in the healthcare arena. And so if you are joining for your first time, you're welcome. And we want to begin this session by taking this time to thank all of you, our regular viewers who take this time every fortnight on Saturdays to tune in at either 1 p.m. Eastern time or 6 o'clock now Cameroon time. We want to thank you so much for the sacrifice. We keep doing this and we keep improving on healthcare in Cameroon. And today we shall be moderating the session together with Brian Tegomo, who is our moderator from Nebraska, and that's in the USA. And we have Tazinya, who is also going to be moderating today with us from Washington State. And we have Christelle, who is our Francophone moderator, who is currently in Yaoundé. And of course, we'll be expecting to get Alexis, who is also in Washington State, and also Louisa, who is in Canada. We want to take the opportunity to, of course, introduce our chair to those who are joining in for the first time. Our chair is Dr. Muno Ken, who is a resident, who is a fellow in hemato-oncology at Richmond University Teaching Hospital in Staten Island, New York State. So, ladies and gentlemen, it's always a pleasure to have you here. We have a very interesting topic today. We shall be talking about telemedicine in Cameroon, and we have brought an expert, someone who is really doing great, amazing work in this area, which is a very contemporary area that is transforming how we take care of our health. And we shall really be having him to present to us what he thinks about this space in healthcare in Cameroon and what they are doing to improve on this space. So, Christelle, over to you.
Elvis? Yeah, thank you. Bonjour, en fonction de où vous nous joignez, bon après-midi, bonsoir et bienvenue à cette énième édition de Cameroon Town Hall. Cameroon Town Hall, c'est une plateforme qui regroupe les professionnels de santé du Cameroun, tant médecins, laborantins, pharmaciens, chercheurs, infirmiers, tous les professionnels de santé qui veulent apporter leur contribution au programme de santé de notre pays. Et depuis plus de 2 ans déjà, nous tenons ces séances toutes les 2 semaines à 13h, heure de New York, et 18h maintenant, heure au Cameroun, à Yaoundé, et partout ailleurs en Afrique centrale et l'Afrique centrale. Donc, Cameroon Town Hall, c'est une plateforme qui a plusieurs membres. Nous avons d'abord le chairman, Dr. Muno, qui est aux États-Unis, ensuite Elvis, Brian, Teresa et Alison, qui sont aussi aux États-Unis, qui nous rejoignent depuis les États-Unis. Nous avons Louisa depuis le Canada qui pourra nous rejoindre d'un moment à l'autre. Et pour cette nouvelle édition, 48e, nous avons l'honneur d'accueillir Dr. Tazinya qui va nous parler et nous apporter sa contribution de la place de la télémédecine dans notre pays et aussi pour le continent. Merci infiniment d'avoir accepté cette invitation, Dr. Tazinya. Merci à tous les fidèles participants et à tous ceux qui nous suivent depuis les réseaux sociaux, Facebook, Twitter, ainsi de suite. Et aussi ici sur Zoom, merci infiniment de faire partie de cette équipe et d'apporter chacun sa contribution à la réussite de cette édition. Sans plus tarder, Elvis, tu veux dire quelque chose?
Merci beaucoup, Thérèse. It's always a pleasure to have you with us on the town hall, one of those, very fervent participants of the town hall. And I really want to appreciate the effort you are putting to be in Cameroon and to always tune in, even when we had the time difference of 7 p.m. in Cameroon, you were always making sure that you're on this platform. So really appreciate your effort. And so we shall just be taking a round to get a word or two from our moderators before we hand over to Dr. Muno for updates on COVID-19. We have always had this tradition of starting every session with some updates on COVID-19 because that was one of the first things that triggered the formation of the Cameroon Town Hall for Healthcare Professionals. So before we get to Dr. Munoken, let's hear a word from Therese. Therese, hi, how is Washington State today?
Hi, Elvis. Hi, everybody. Washington State today is so sunny. Like there's no rain. Everywhere looks good. I'm outside. I'm ready for gardening. I'm ready to go to the park. Everything looks good. And yes. So I'd like to thank everybody for coming in today. And we're always happy when we have a lot of people joining our platform. We're already at 21 participants. Let's keep joining and we're going to have a good time today. Thank you.
Thank you so much, Therese. It's always a pleasure to have you. And of course, we always have a lot of people who follow us on Facebook, on YouTube, and every session, we always have a total view of not less than 1,000 people who actually view our session. So we want to continue to encourage everyone who is on the platform. You can share the link on your status or on your Facebook, just so other people who have forgotten about the start time can join us. Hi, Brian. How is it in Nebraska today?
Thanks, Elvis. It's great. It's 75 degrees Fahrenheit. It's a cloudy, sunny day. It's amazing. The wind is blowing. Just amazing climate. I'm super excited about today. It kind of reminds me of the session we had a few weeks ago with Dr. Emmanuel Fombo about the future of healthcare. So I'm really excited about this discussion with Dr. Alexis Tazinya, who is going to talk to us really about the role and the place of telemedicine and how that's really transforming the medical landscape in Cameroon. I'm really excited about this discussion today. Thanks, Elvis and Christelle. It's nice to see you. It's Therese, it's nice to see you as well. So looking forward to a great session.
Thank you so much. It's very interesting to know that we are all having a very good weather across the different states, and of course I will call someone who is not a moderator, but a very regular person, just to check up in California and know how it is there today. Kenji, hello. How are you today? Okay. We might not have him available on his mic. And maybe I check with one other person just to do some checks and see how it is today in Canada. Since Louisa is not here to tell us, but I think Agbo is here to tell us. Hello, Agbo, Dr. Agbo.
Hi, everyone. Hi, Elvis. It's been a long time. I haven't been around due to some commitments, but I'm very delighted to be back, and I'm very pleased to see everyone, and I'm happy with everything which is going on. Telemedicine is something I'm very, very interested in, especially I know we've discussed the ratio of physician to patients in our community. So I think something like telemedicine is something that can maybe alleviate that pressure. And so it's going to be a very exciting session today. And for the weather, okay, this is a warning. I live in Edmonton. It's sunny, but the temperatures are relatively cool. It's like 11, 12 degrees out here. And by Edmonton standards, that's warm. So that's where I leave you guys. And hopefully looking forward to having this exciting session. And good afternoon and good evening, everyone.
Thank you so much, Agbo. We missed you for a long time now, and I was wondering and thinking that it's not football season. What can be taking my brother away? But thank God you are here, and we look forward to have a very interesting session with you. And I'm sure there will be some time for you to give us some updates on what is happening in your area of expertise. I always call it your extra area of expertise football.
Sure. Thanks
knows
for everything
about that. But of course, you are our trusted authority when it comes to issues of diagnostics, laboratory, and regulations in that space. So we will always want to hear your take on anything that leans towards your direction of expertise. Hello, Monon. Now is the time for us to turn the microphone to you to give us some updates on what is happening in the area of COVID-19. We've heard some records of increased cases in some parts of the US, that the case during the spring were increasing. And We heard that increase started in China and they had some lockdown and it actually affected the economy to a certain point. We've heard stories about similar increase of new cases in UK. I want to know from you, are we still expecting more increase in the number of new cases, or do you think now it is getting to a plateau? Are we having a decline?
Yeah, Elvis, thank you very much. And I always want to thank you guys for your time, your commitment, and also for making the Cameroon Town Hall a place for everyone. You guys are really, really fabulous, and I don't know exactly how you guys do this. So I will just go straight up and try to use 10 minutes, let's say so. So talking about COVID, what is important is that COVID is not going away, it's not going anywhere soon. So you do see the Omicron variant is really the most dominant variant we're having now. And in the US, we're moving to the Omicron BA.2.121, which is becoming the most dominant variant. And I think in the next 1 or 2 weeks, it's going to be. The BA.2 is still the most dominant. In South Africa, we're having the BA.4 and 5. And we're getting to the point where I know it's not affecting everyone in the world. There is confusion in how we should travel. Should we mask or should we not mask? I'm a public health physician myself. Apart from being an internist and a pathologist, I'm a public health physician and I do believe in masks and I have evidence that they do work. So I'm going to advocate for masks. I just traveled and while I was traveling, the mask rules were changed and it was very amazing to see how people were very excited to leave their mask. So while in airports, I know we do know this happens all the time. Are people going to be in the position of not even accepting to put on security masks when they're going to be asked to? This is just a cartoon to show you that there are people who are actually just pure detesters of what's going on. I think we're all waiting for this to happen, for the CDC to react. If they do believe in the policy, they need to actually tell the government in order for them to actually file a case against the Department of Justice actually did file for masks to be reinstated. But this is kind of a big political issue. And I think other countries will follow suit. As the US demasked itself, other countries will do the same. So we need to be very careful with what leadership we're sending across. This is just a study in San Francisco showing you how masks were stopped and the number of cases in schools started going up. I have about 2 colleagues who just told me today that their kids are all sick and they are in New York, so those kids had not been vaccinated. They were less than 5 years old, and the whole house is now getting infected, though they are asymptomatic, so COVID has gone nowhere. And it's important to know that the death rate in the US, a lot of people are taking this for granted. Africa has been spared, Cameroon in particular, I'm very happy about that. But in the US, you see that at a certain point, COVID was the highest killer, and right now COVID is still number 2. So it's nothing to really say that COVID is not killing people. COVID is not the flu. And we do know that the number of children who got infected with COVID with the last wave, out of every 3 in 10 child actually had some problems when they got infected. And while they were in the hospital, 9 out of every 10 of them were kids that were unvaccinated. And 2 in every 10 required an ICU among those who were there. If you look at the state of COVID in the world, as Elvis made mention of, we do have COVID in the whole of Western Europe. It's really, right now we're having a high number of cases there, though the number of deaths have drastically reduced. The US and Canada is still having a number of cases, Brazil and Argentina. Then mostly we're having in Asia, mainland China, and we're also having Australia, Japan, and South Korea. So North Korea, we don't know exactly what is going on. Then looking at COVID, I just took a look at this. This is my area this morning, is showing you the number of new cases. In the hospital, we're not really seeing that rise. Actually, in my hospital right now, there is no patient who is hospitalized for severe COVID. So that's great. But if you see the US, the number of cases are actually going up. New York is going up as much as Vermont, but it's not as high as Europe. And we really are trying to figure this out, why we are not having the number of cases Europe is having. I think it's more of herd immunity. A lot of people got infected in the US during the first, second, and third waves. And here is the same number. The number of deaths are not increasing. Number of hospitalizations are not increasing. So the tools we have are actually working. And COVID hospitalizations remains muted, which is very important for us to know. And it's important for Africa too, because we have not had a high number of COVID cases. So we need to still be vigilant over there in Africa. This just shows you as of about a week ago, the number of cases that were sequenced. I think they are responsible for sequencing this thing all the way. And we do know that the BA2 is actually the most predominant in the US and also in Africa, but the BA4 and 5 is rising, while in the US, the BA2.121. And here you can see that this is the rise I'm talking about and the number of new cases. And just comparing BA1 and BA2, you can see that they are very similar to each other, and the 3 doses of vaccinations really do work. So people should get boosted if they are able. This shows you just the genetic tree of COVID and showing you the diversity and showing that the virus is still mutating, and every mutant is getting more infectious in what we are seeing. So in order to knock the other mutant out of the way, you need to be more infectious and not necessarily more severe. So this shows you exactly the number of mutations we do have, and it's actually accumulating more mutations with time. Here is just a recent mutation prevalence across lineages, and it's showing you the BA4 and 5, which were sequenced in South Africa. South Africa is doing quite a great job concerning COVID, and they have been able to sequence and help us with the GSED database that I think Brian works on this database also, and he's a pioneer in what is happening in Africa and how teaching the Africans how to do the sequencing. So just to continue and show you exactly what is happening, this is in South Africa, is showing you that the Omicron BA4 and BA5 are taking over from the Omicron 1. And here is also showing you that there is also some recombination occurring between Delta and Omicron. Now, as Elvis talked about, China and Taiwan are actually having increased number of cases because Omicron is more infectious, and the methods they're using are not really working because they need to really adopt this Swiss cheese model. So we do know that those who are above 80 in China, we have a lot of unvaccinated people, despite China having its draconian methods in order to force people to get vaccines. And the vaccine they're using also is becoming a problem. So they're trying to get Pfizer and Moderna in order to help the system. This is just data showing you that if you have 1 dose of Pfizer compared with the Chinese Sinopharm vaccine, you realize that the efficacy is not the same, even with 2 doses, but it actually gets almost equal once you get 3 doses. So this really shows you what problems are occurring at the moment in China. And this year shows you the number of unvaccinated persons in Beijing, in Shanghai, and in China. So the number of cases are increasing. Here you can see the different waves. We had a lot of cases in New York. So right now we have a lot of herd immunity. Even people that are getting infected, they are not getting severe disease, while cities that do not have enough infections are getting more patients dying. So 20 times higher risk of death for unvaccinated person in Hong Kong. That's what we found out in the CDC report. And this is very interesting because we're trying to see how we can do surveillance and detect new variants. And the most important way now is using sewage. And with time or some other day, Brian is going to tell us how this works. Because in the US, there's self-testing, the number of testing that people are getting, even in Cameroon, people now have to pay 30,000 in order to get a COVID PCR. So it's going to be difficult to get data and to test people. So the world really needs to invest in pandemic prevention, and we need to actually put in more money in order to prepare for the future. We're trying to reach the finish line, but COVID is still running away. And I think this is going to be a race that is going to take us several years. The Swiss cheese model is what we really need to do. We need personal responsibilities, and we also need shared responsibilities, like putting on masks in public places. I think it's a shared responsibility, and we need to get apolitical about it. So these are the different methods that we talked about each time in order to take care of COVID. I think we have spoken about all of these methods, but therapeutics is one of the things that is going to move into 2022. We'll have many drugs. We have come to the end of the road with mask mandates, and what do we do going forward? How do we prevent ourselves? How do we interpret data in order for us to make good scientific decisions? The number of cases, if they had told me 2.5 years ago that we would have over 500 million people infected with COVID, which is actually an underestimation by almost half. So almost 1 billion people have had COVID. And right now we have given over 11 billion doses of COVID vaccine. I think this is the highest number of vaccines that we have ever given to any population in the human history. And people still don't believe in it, but we're giving more than 11 billion of vaccines. The number of cases in the world is what I just presented. The number of cases is rising, but the rise is very slow. Number of people who have died, almost 6.2 million people have died of COVID, which is sad. Some of these deaths can be prevented. In Cameroon, the number of cases have not increased drastically. It's also due to underreporting at the moment, and also due to the fact that Cameroon and other African countries have been lucky, and this can be a whole debate. And also we have done a good job, kind of. So it can be a whole debate for a whole session in the town hall. The US still has the highest number of cases actually, and the highest number of deaths from COVID. Here, I'm just showing you the timeline on the discovery of vaccines and how we must applaud ourselves for the great innovation that the COVID vaccine has led humans to do. So we now have 11.5 billion people who have had the shot, and Africa is still under-vaccinated. Cameroon has vaccinated only 6.9% of its population. That is shameful, despite the fact that we have the availability of vaccines. So we have done a very poor job in convincing people to get these vaccines. We do know that Africa also has a problem to accessing vaccines and accessing the right type of vaccines. Low-income countries are worse hit. High-income and upper middle-class income countries have really vaccinated their populations well. And this just shows you exactly what is happening in the world. Now, looking at this chart, you can see what kind of vaccines were available for each country. The Oxford AstraZeneca vaccine was the most available vaccine. It's very fortunate that Cameroon got Pfizer, got Johnson & Johnson, got a lot of the good vaccines, but still did not vaccinate its people. And here we can see that getting 3 doses of the vaccine actually reduces your infection rate and also you getting severe disease. So here is just showing the structure and showing that we need to do something in order for us to be able to get a universal vaccine that is going to work over time. Now, moving over to just talk about 3 doses and a booster actually still works and reduces severe disease. And this is research from Israel showing a 4th dose that actually reduces severe disease by 78%. So in the US, it has been approved for patients greater than 75, and I think greater than 65, and I think other countries need to follow suit, and the whole of Europe also. So here is just showing you no matter your age, even if you're young, getting vaccinated and getting a booster reduces your chances of getting severe disease. This data is the same. I'm just going to go through this. It's same data, just talking about this. Here, I like to show this slide because it shows us exactly what we did in 1 year, and the human race, if concentrated on something, I think devotions on sickle cell and other diseases will cause us to also reduce mortality and actually help fight this disease with time. And this is how we have been able to short track the discovery of vaccines, and we can short track the discovery of many other drugs in other diseases. Are we done with the variants? I think we are not. Omicron is high up there, very infectious, 4 times more infectious than the original variant, and also 4 times more contagious and 4 times and less severe. But now, when are we going to have pi? When is it going to come up? It's going to come up one day. Are we going to lock up ourselves? Africa going to learn from the cold chain and learn from all this mistake and get better? It's still a question of debate. When are we going to have a dream vaccine which is going to not be influenced by mutations? I think the water read is working on that. And still concerning treatment, just summary, nothing much has changed. WHO actually updated its treatment protocol. And it's very exciting that we have a drug for every phase right now. We do have a drug for non-severe patients in order to prevent them from getting severe disease, molnupiravir, and you have the Paxlovid, which is the best drug right available. Sotorasib is also available. We have medications for severe and critical patients, which can be available in Africa, corticosteroids, and also baricitinib is quite available. Interleukin-6, which is tocilizumab, is quite expensive and may not be available, but I know baricitinib, Eli Lilly has actually provided baricitinib that can be given in African countries. And those of you are supposed to use more effective in patients who have mild disease than severe disease, though we used it for severe disease a lot. So this is really a summary of what happened. Those who need any update on treatment, you can always contact me, email me. I'm going to let you guys have a copy of what is up to date right now. Concerning this, the clinical trial that was published in New England Journal of Medicine showing the efficacy of Paxlovid. And here is data, just visualize data showing you exactly when it's recommended and the efficacy. So Paxlovid actually reduces the chances of you getting severe disease by 90%. That is amazing right now. And it's subsidized, it's free in the US and Canada, and also free in several countries in Europe. This is the mechanism of action for those who are interested in basic sciences. And here you can see remdesivir is also having a strong recommendation for those who have not yet developed severe disease, though the US used it for severe disease. There is the Evershield, which we use it for those who cannot get vaccinated for one reason or the other. I'm an oncologist. We do have patients that are getting, they do have, let's say, diffuse large B-cell lymphoma. We're depleting their CD20 cells, so they are unable to get vaccinated. We have a long-acting monoclonal antibody that prevents infection, and it reduces the chances of them getting severe disease by 90%. So this is just a summary telling you guys about treatment and how far we have gone with COVID. And I think we've done a big movement and discovery during this period. It's taken the world a very short time to tackle COVID. And please, I am one of those who believe that data should justify government decisions and not emotions. So this is just for other countries, including the US, to think about this. Our emotions should not be justified by data. Africa should not stay complacent. We should know that a lot of people don't yet have herd immunity. We should keep ourselves ahead of the ball. And because we have not yet had very severe disease, and so we should get ourselves vaccinated. This is just not to scare you guys, to tell you that long COVID is also a thing, and it can affect it can actually affect the reproductive organ and affect the brain. So Elvis, thank you. I think I was on time. Thanks.
Thank you so much, Mona. It's always a great, deal having you to do this presentation. That's why sometimes when I sit, I don't bother about what's happening in the world of COVID, because I know 2 weeks is not such a long time. I'm going to get it all from you. Thank you so much for the effort you take to put together this. Cameroon has just vaccinated only 6.5, if I got you right, % of its population. This seems really low relative to what other countries have done. I know there are a lot of debates around this subject, but of course, Brian, I know you, Alison would have been here to tell us about vaccine hesitancy, but apart from vaccine hesitancy, Brian, do you think there could be some other reasons why we are lagging behind in terms of vaccination against COVID-19?
Yeah, I think that's a really important question, and I think one of the things we've come to increasingly recognize throughout the pandemic is how important anthropology is, and sociology, and really connecting with people at the community level. I think fundamentally we did a poor job in terms of public health communication throughout the pandemic, and messaging itself, and how we translate even the research studies that we have, and how we communicate those to the public. And I think overall we didn't really do well, and there's a lot of changes and things that has to be done around that. I personally think that communication has to be an integral part of public health training, whether you're doing epidemiology, biostatistics, or whatever, but we need to incorporate that into our curriculum as well. That's really key. Sociology and just the integration of anthropology, and relating with where people are coming from, traditionally, their cultural beliefs and all that. That's really capital, and I think that's something that we really missed on. So, and I think that's capital towards really, hesitancy and the issues that we've been facing around vaccinations and things like that.
Yeah, you're very correct. And let me, Christophe, vous êtes au Cameroun. Quel est le comportement d'un Camerounais vis-à-vis le vaccin contre le COVID-19? Vous êtes sur le terrain. Quand vous parlez avec vos malades ou les amis, quels sont les rapports?
Oui, Elvis, je crois que je suis d'accord avec Brian, parce que en plus de l'hésitation, je crois qu'il y a eu un gros problème de communication, parce que ce soit les malades, que ce soit le personnel médical aussi, c'est pas vraiment la pleine satisfaction et le plein engouement pour recevoir le vaccin. Sauf s'il faudrait vraiment, c'est obligatoire, peut-être pour voyager, pour faire un avancement peut-être professionnel ou aller dans un service, mais sinon que de manière spontanée, ce n'est pas vraiment, c'est pas la première idée qui vient à l'esprit, je dirais, malheureusement.
Docteur Abor a une avis. Pour lui, il pense qu'il faut qu'on emploie les anthropologues, les gens qui connaissent ce travail, de nous faire ce travail. Et que le problème, c'est parce que nous pensons que c'est le travail des gens qui sont dans le domaine de santé. Quel est votre avis par rapport à cette idée?
Je pense qu'effectivement, c'est multi-tâches, c'est multi-professionnel et nul n'a le monopole du savoir. Donc, de même, la médecine a ses principes et ses valeurs. De même aussi, il faudrait, pour qu'ils soient appliqués dans un terrain particulier, il faudrait avoir l'avis et consulter, travailler de commun accord avec des anthropologues, des sociologues définitivement, parce que la maladie n'a pas seulement une définition scientifique, mais aussi culturelle et l'acceptabilité dans le contexte qui est le nôtre comparé en Europe et aux États-Unis. Je crois que c'est différent. Donc, il faudrait bien maîtriser le contexte avant de pouvoir appliquer les règles mondiales au niveau national, vraiment multidisciplinaire. Merci, merci. Yeah. C'est mon avis.
No, thank you so much for that. I mean, it's very true. We really have to be open in our approach towards public health implementation, not just relying on what we know. We have to bring in all stakeholders and learn from those who master certain issues that is a little bit out of our scope. I really agree with you. And I can see Luisa is with us. Luisa, hello. Okay, Luisa might be a little busy, but let us check with Valngwa. Valngwa, what can you say about the low COVID-19 immunization rate in Cameroon? Any idea, or what are your thoughts around this problem?
Well, thanks for asking. So can you hear me?
Yes.
Thanks for asking me. I think I was where I came in was when we were talking about trying to get sociologists and anthropologists involved in the message. I was saying, in my opinion, and what happens here in the UK is public health is a specialist training as a rotation, not just the MPH, which covers all those aspects of the sociological aspect. So by the time those specialist trainees go to the terrain, they will understand the cultural aspect of their population and be able to engage with them better. I think the question has been partially answered when people say the engagement with the population wasn't adequate enough for them to understand exactly why the vaccine should take precedence over other of the health initiatives or the health problems, say malaria, for example, or just the poverty that they're facing. And besides, let's not forget, it's not the population where they were seeing massive deaths as we were seeing in the West, possibly due to the fact that they are a relatively younger population anyway. I think that the dissemination of the message to the population hasn't been good enough. And it hasn't been good enough because those who were mandated to do it did not have a good knowledge of who the population is or what their cultural beliefs are. Those are things that we need to engage in more fully so we know who we're talking. We cannot transport messages from Europe and America back to Cameroon and expect them to get the same effect as they do abroad.
Wow, thank you so much, Val, for that very interesting thoughts. Thank you, ladies and gentlemen, for once again tuning into the Cameroon Town Hall for Healthcare Professionals. If you just came in, this is a platform that brings together healthcare professionals from Cameroon who are spread all around the globe, and we always meet every 2 weeks to talk about issues that concern the health of our people back home. Today, we shall be talking about telemedicine, and this is a very interesting subject, and we want to pass over the microphone to Brian to introduce our guest for today.
Sorry, I was muted. Hi, thanks a lot, Elvis. I'm really excited to present, to introduce today's speaker and also the topic that we have today. digital health and telemedicine and how this is transforming the medical landscape. I think the importance of telemedicine and digital health was heightened throughout the pandemic. I think we've come to increasingly recognize how critical it is for us to build these kinds of systems and these kinds of infrastructure to improve health. Look, I don't know exactly what the doctor-patient ratio in Cameroon right now is. I know we've had an expansion in the population and all that. So we definitely need to think about innovative tools and really ways in which to address this this huge gap. So I'm really excited to present Dr. Alexis Tazinya. Dr. Alexis, he did his medical studies in Cameroon. He graduated from the FHS School of Medicine in Boya and worked in Cameroon for a while. And in 2018, he was one of the Mandela Washington Fellows. So he actually came to the United States to do his fellowship as a Mandela Fellow in Minnesota. If I'm not mistaken, and he's really been a great inspiration for particularly many of the students from the University of Boya. He did his Masters of Science training at the London School of Hygiene and Tropical Medicine, and has really been one of those strong advocates of digital health translations, particularly in Cameroon. So he's trained as a physician, as a public health specialist. He has multiple years of experience in the implementation of public health programs. He has worked with multiple organizations. He has founded organizations that work with communities across Cameroon with HIV screening and essential health services. He has been working with the fight against non-communicable diseases, coordinating monthly activities for the May Measurement Month, which has reached more than 35,000 people in Cameroon communities. So I'm really thrilled to introduce Dr. Alexis, and it's really such an honor to have you with us today, Dr. Alexis, and I'm really proud. So I'm really looking forward to your remarks as we look into this sphere of digital health in Cameroon. Dr. Alexis, if you're around, take it away.
Thank you very much, Brian. I just put on my camera. I hope, and mic, I hope people can, everyone can listen to me and probably see me.
Yes, we do that.
I have a confirmation. Thank you very much. Thanks very much for the presentation. It's a pleasure to be at Cameroon Town Hall for Healthcare Professionals. It's my first time, a bit ashamed to say, because such a platform, gathering together this caliber of people, discussing such important subjects on a weekly basis, someone like myself who has similar interests should have been very actively part of this. But I've been unavoidably absent because of many reasons. I'm happy to be here today and also to be a speaker at this event. I would prefer to say this is a discussion about digital health in Cameroon. And while I put together some slides, which will last about 15 to 20 minutes, I would prefer if we discuss after this. I'm very sure we would have many questions to ask, and that might be the most interesting part of this exchange. Thank you very much. And I would like to share my slides. I don't know if I have permission already.
Yeah, you do.
Thanks. Good. Any confirmation if you can see my slides so that I write on?
Yes, we can see your slides. Just put them in the presenter mode.
Okay. Perfect. Yep, so I'm Alexis Tazinya, as earlier presented, and these are the few points that will guide my slides. I'm going to do a brief introduction of what Waspito is. I'm the Chief Health Officer of Waspito, as presented. I'm going to present Waspito, present the problem Waspito is trying to address, propose solutions which we are bringing on board for Cameroonians and Africans in general, and discuss a little bit about digital health in Cameroon. There are a few concerns and questions which a few people have, which I'm hopefully going to share the knowledge I have as well in the field of implementing it. So I'll begin by asking a very simple question, like when was your last telephone consultation? I'm very sure we have doctors in the house, patients and people who have consulted. When was your last telephone consultation? This might have been to a family member. This might have been your in-laws calling you from Cameroon to asking you to bring them that medicine or send them to explain a certain problem for them. When was the last time? And if you are not a doctor, when was the last time you had a telephone consultation? Was it with a specialist? And how did the prescription go? How did that doctor ask you to take that paracetamol or ibuprofen? How did it happen? Was it just a verbal prescription? And how long did you have to wait on a queue if you had to go see a doctor? And imagine how long all these processes would take. For those who don't have family members who are doctors, imagine how many people they have to speak to before they get that expert advice. Now, what is Waspito? Waspito is simply a telehealth platform which provides, or which is trying to provide access to quality healthcare by connecting Africa's healthcare ecosystem in one place. So whoever is a healthcare provider or healthcare seeker, we're trying to provide an opportunity for you through our mobile applications or websites where you can access this service. And we also try to make sure the services are of quality, not charlatans being on the platform or non-approved services. The problem, very common on the lips of many people, we have poor healthcare access in Africa, the doctor population ratio, compared to other places like Europe and the Americas. Of course, there's great disparity, and many more doctors concentrated in big cities. If I were to pick a simple specialty, such as maybe a urologist or cardiologist, which should be very common in many places, but I bet you there are many towns and villages in Cameroon where if you were to do a simple cardiologist consultation, you would have to travel across many villages to actually have that service. And many people, because of this poor access, geographical access, sometimes a lot of consequences happen in between. And self-diagnosis, self-medication is prevailing. Those who don't have doctors in their families, of course, they go by the roadside and pick up medication. So the solution Waspito is providing is, we try to provide a health social network, such as maybe a Facebook for healthcare. That might be the simplest way to describe it, where we have a community of doctors and patients. We provide instant consultations. So it's not a platform where you come and book to see when is the doctor going to be available. It's a place where, just like WhatsApp, where you see a doctor online and you ring his phone. Advantages of using a platform, which we try and provide these advantages, is that the patients get instant, affordable virtual visits with the doctor. Consultations in a town like Douala ranges for between 10 to 15,000 for generalists, and we're providing it for 3,000 francs. We think it's affordable, understanding the situation and the market demands. Discussions on the platform are free and anonymous. Currently on the platform, we have several groups on different subjects. People can discuss anonymously, exchange between other users and doctors. Doctors can earn an extra income by using our platform. There are several doctors, even in these places where we say we have a great disparity for patient-doctor ratio. I know many doctors who sit in offices and wait for patients for several minutes and sometimes hours. But then there are villages where there's hundreds of people who want to speak to the same doctor. So these doctors have an opportunity with Waspito to consult people remotely. You can be in Douala and consult people in Marwa. That is possible, and it's happening today in Cameroon. And doctors earn money by doing this. We give doctors exposure in this social network to actually increase the number of consultations they make. This is a preview of what the platform looks like. We have like the health social network part. I don't know if my mouse or cursor is going to be visible, where doctors write small, short, educative messages, post pictures, health tips, and users can like, share, comment like any other social media platform. On this other screen, the second screen here, you have the interactive forums, which are just groups where people can discuss anonymously. And then you have, when you click on the doctor consultation button, you have a list of doctors. You see who is online, who is offline. If someone is online, you can immediately ring them, and if they're available to answer, they'll pick up your phone and give you that expert advice. How do people pay on the platform? They use mobile money, Orange or MTN, or if you're an insured client, you can claim the service with your insurance number. A few milestones which we have reached. We have about 25,000 app users. We've had more than 2,000 consultations so far. We are 2 years old, just to mention. We have more than 70,000 service providers. That includes clinics, laboratories, imaging centers, and more. A few awards or recognitions here and there. We're currently in Cameroon and Ivory Coast today. We recently set up an office there and operating similar services. We also recently announced the closing of our seed round. We raised about $2.7 million to permit us expand our services, grow in Cameroon, and then do the same in Cote d'Ivoire. A few advantages that one has or user has using Waspito. First, every doctor on the platform is verified. Several doctors apply to join or to use the platform, and we have to check each account with the CMC to make sure that doctor is a certified doctor to practice in Cameroon. So just to add more clarity to this, in a place like Cote d'Ivoire, to be on a platform, you have to be a certified doctor in Cote d'Ivoire to practice there, licensed to practice there. Then you can provide your services online to clients who are there. Same for any country where we're going to move into. 100% confidentiality, which we guarantee people, and security of their data. So our platform is built using HIPAA compliance, and our operations and processes also respect HIPAA compliance, which is just a set of rules or regulations or guidelines that help protect users' data. Another advantage is that we reduce what I call avoidable hospital visits. We did a small survey in the early stages of our company, asking doctors how many times they had to physically touch a patient during the consultation room, and we realized in many cases more than 30% of clients were never touched. So the consultation was just that interaction, physical visit, and where the patient explained what their ailment was, and the doctor had to prescribe based on the understanding of the problem. So we think that these are avoidable, what we call avoidable hospital visits. Why would you have to travel all the way and wait for 3 hours or several hours to see a doctor who is not going to touch you? That could have been done on the phone, virtual consultation. We think the technology is already possible. Let's use it. Let's advance with the world. We have a few partners that facilitate our work. We have several, but these are like a few major partners, Orange Cameroon and some insurance companies and other food companies. That is it a bit about Waspito. We can discuss further in the question and answer session. A few slides about digital health in Cameroon. The WHO, I think in the World Health Assembly of 2018, if I'm not mistaken, mentioned that digital health was a very important tool to strengthen healthcare systems across the board, and especially assist in achieving universal health coverage for every country, whether you're developed, underdeveloped, developing, it doesn't really matter. Digital health can help you facilitate or assist in achieving universal health coverage. The current state of digital health in Cameroon, as described by the government, is described as, they say we are now in a desk study phase and interactive exchange between key players. So there is a pile of documents at the ministry's table to create a certain platform or a legal framework to guide the practice of telemedicine, which is relatively new compared to the traditional way of practicing medicine. Many players are involved, like Postel, Mincom, Ministry of Health. There are several players, including private sector, to design this roadmap and the legal framework that is going to guide the practice of digital health and healthcare services. I put in this slide to give us a snapshot of what it looks like for Cameroon today. So these are major components of an ecosystem for interoperability. What is in blue is what is already existing in Cameroon. What is in a bit yellowish color, orange, sorry, my color knowledge is not very excellent. It's actually like in process, and then the gray areas are not yet operational. So this is from the government. So there's a registry already in place. We have analytics programs that are monitoring, like that monitor diseases like the DHIS2 systems. There are several mobile applications that have been used, piloted, some are operating, including like Waspito for now. Electronic medical record systems, some have been piloted in big hospitals like Lakentini, etc. The pharmacy sector is a bit lacking or lagging behind. registry for healthcare workers is lacking. Sorry, we just have lost electricity, so my image might not be able to see me. Part of the challenges of digital health in Cameroon also for this. So there is this strategic plan, which is a document that the ministry put together to describe how they're going to use and implement digital health. It was done for a 5-year period. Let me see my previous slide. It was done for 2020 to 2024. And I put in this slide just to say, to highlight some issues that came up in some doctors' WhatsApp groups recently, where there was a concern, oh, is this legal? Like this digital health thing, like, are we supposed to be practicing it? Is it allowed in Cameroon? It's an interesting question, but to say that yes, it's not legal, that's a political phrase I just made, to say it's not legal because there is no legal framework that guides it. But it doesn't mean that the government is prohibiting the practice of digital health. They are putting in a lot of money. They put more than over 11 billion francs CFA from 2020 to this 5-year period just to enhance this plan. So it's not legal, but there is work in progress to try to regulate it. Like anything else, it has to be regulated. Otherwise, there might be malpractice, there might be issues around how do you manage issues in court when there is no legal framework guiding it. So that is what that's what is based on these that people say it's not legal in Cameroon. But then it doesn't mean it shouldn't be practiced. The government actually is certainly behind us. They encourage what we're doing in the private sector, and a lot of the work we do, like Waspito or any other telehealth or digital health platform, is going to go a long way to guiding this legal framework people talk about. Yeah. What challenges have we had as a company so far? Internet access is one of the big challenges, and the quality as well. So our platform for now is solely dependent on internet. You need internet access to be able to download the app. You need internet access and to be able to have a video call with a doctor. And not just the access, but it has to be of good quality. Otherwise, just like WhatsApp or any other platform, you might be in a consultation and then you have like power failure. If you're using a Wi-Fi system, definitely we would have been disconnected. So these are some challenges that we have with digital health, with Waspito actually in Cameroon. The perception of telemedicine by users and some providers. Some users don't believe that they can actually speak to a doctor virtually and have your problem resolved. It will take time. We're trying to work on the communication plan for that. Some providers, it's true that most providers, be it nurses or doctors, spend several years in school learning how to palpate, auscultate, and percuss. And digital health so far doesn't give you the opportunity to do that. But I think our practice is not limited to that. Many providers just feel that, no, I shouldn't have been doing this. I must see the patient. And it's interesting because many of these people who say they must see the patient speak with their aunties, cousins who are in different towns, even across the country, and they make prescriptions. I mean, it's really funny. But if you have to be honest with yourself, sometimes I personally prefer to say what happens in the black market or in the informal sector, it's only a signal of what should be legalized and controlled. So if you actually do these prescriptions on the phone, maybe you should consider accepting telemedicine as a platform where you can provide your service. I've reached out to some doctors who feel like they shouldn't register here. The client must come and see them. Anyway, it's a matter of time. I think it's like a train. Everybody's going to get along at some point, not all at the same time. The legal framework, the fact that the legal framework is not yet in place for digital health in Cameroon slows down our activity. It's not just Cameroon that is facing this problem. I don't know any country in Africa so far that has a good legal framework that can accommodate and guide the practice of digital health, telemedicine in particular. So because of this, there are some insurance companies, some services that will not be vetted if you received them remotely. But we believe that if there's this legal framework that is put in place, it would help us to penetrate the market better and provide more services. The technology, I put this as a challenge because sometimes we have 101 ideas, but the pace at which technology brings them to realization might be a bit slow. There is this slide I put down here. This is a screenshot from one of the governments from this digital health strategic plan, just showing you about how much money the government spent in 5 years just to encourage this idea. So if someone thinks digital health is illegal, they should consider how much money the government is spending to make it happen. I also thought that if we use the SWOT analysis, it was done during this meeting for the strategic planning, to try to describe or to make an initial assessment of the situation, at least as of 2004, sorry. This was the situation. So some of these things might have improved. 1 second, there's something covering my screen. Oh. Sorry, I'm trying to put away this. Oh. Just give me a second. I'm unable to see some of these points. Okay, I'll discuss the strengths. I would like to go through them one after the other. I think this is an in-depth, it might give anyone an in-depth understanding of the situation in Cameroon, like what is the situation of digital health in Cameroon. Strengths is that there is a political will from the government. There's a lot of collaboration between partners that are interested, NGOs, donors, the World Bank, the several people who are interested. Several existing training facilities, people are already doing like training in digital health, either remotely or in several schools. There are several existing institutions for data engineering. The universities are training developers, some of which are our employees in our companies. There's a section in the e-government master plan recognizing e-health and trying to promote it. Existing data collection systems for epidemiological surveillance are one of the strengths. We also have the DHIS tool, which is might play a very big role in helping the government actually make a big step into the digital health usability. We have other platforms, at least as of that time, as the Cardiopad, Give 10 Mom at the time, Dharma, and there is this availability of a national indicator protocol, which they're trying to harmonize to make some of these platforms interoperable. Weaknesses: lack of a unified version and strategy for digital health amongst the sectors. This is a very common challenge. There's absence of an MOH information system, low allocation of financial resources. Many actions that the government had set out to do are not yet being implemented because of the lack of finances. Shortage of qualified staff. It's a new field, not too many in digital health systems and how to use them. Low integration of ICT modules, low capacity of electricity and internet supply. Thank God my electricity came back. Insufficient patient data integration systems. So many of these systems, including the government system, are not very interoperable, and it's going to be a big win if we can make this interoperable. It would help the ecosystem grow much faster. Opportunities for the sector. We have existing training facilities. These are similar to the strengths. I hope you can see the slide so that if I skip some points, you can catch up with them. So we have institutional support, the presence of young ICT innovators, existing government and private initiatives, wide range of ICT, telecommunication specialties. What are some of the threats? I've discussed some of them already. Low implementation of the national cybersecurity policy, budget and financial constraints, possible resistance to change at several levels. We've mentioned a few. Cyber attacks is one of the common challenges when we think of digital health. Patients' records are going to be online. People can hack into these systems. So we are obliged to follow systems like the HIPAA. We don't have a Cameroonian framework, so we have to align with things, either the GDPR for the European countries or the HIPAA for the American countries. Corruption, only 70% coverage of the national territory by 3G and 4G network, lack of experts. So this SWOT analysis was done by the government, and I think it gives a very good picture of what actually the situation is for digital health in Cameroon. Thank you very much. I think at this point, I'll be happy to go through a Q&A session. I think it would help fill in more gaps and then maybe make the discussion more interesting. Thank you very much, Mr. Moderator.
Wow. Thank you very much, Alexis, for this excellent presentation. You can stop sharing your screen. It's really been lots of information, and thank you for the great work you are doing at the level of Waspito. It's amazing that you are the leader in this space in the country. As I can say, Waspito is one of the leaders, major leader in the space of telemedicine in Cameroon. So congratulations for the amazing work you're doing. It's really an interesting exercise. Before I hand over to Brian, who is in charge of this next section of the session, the Q&A and other aspects of the session for today, please permit me ask you one question. When you were presenting, lights went off. If you were doing telemedicine consultation and that happened, what is the next step?
Perfect question. I'm happy that actually happened. It created an opportunity for us to discuss this. So first, I was using my mobile data to have this conversation. Otherwise, like I said, I would have been disconnected. So our phones are mobile phone. Our consultations happen on the mobile phone. If you run out of data, you're going to be disconnected. If for some reason MTN is having a problem or the telecom providers have an issue, you get disconnected. Solution that we have built into our system is that whenever you come back, you would be able to call the doctor again without paying a fee. The doctor can call you, ring you back as well to try to get to you, maybe if something was wrong on your own end. So it took us time to be able to build this system in, but that now is available on Waspito. So yes, the internet might get disconnected. Whenever you come back, you can continue with the doctor. And then even if you have weak internet, the interactions between doctor and patient on Waspito today, you can do it by chat, by audio call or video call. So if you have weak internet, it's preferable if you do an audio call. You can take pictures of your whatever you want to do and exchange with the doctor. But then the audio call uses less internet or bandwidth, so that permits you to have a better conversation.
Thank you very much for that very, very intelligent answer. And because Brian is my very good friend, he will permit me to ask you the second question before I hand over to him. When you talk about the cost, I saw your billboards written there 3,000 francs per. When you think about that as cost for telemedicine consultation, do you consider the fact that the person calling you is the one you paying for the cost of data and the cost of the phone call? And do you factor that into how much time the doctor wastes, or let me not say waste, how much time the doctor spends with the patient on phone, taking into consideration that every second spent on phone is at the cost of the caller, who is the patient? Do you factor that to be able to know how much actually is the cost of telemedicine per consultation? If I should ask, how much is that cost per consultation, average?
The average cost, if we were to put bring the average cost of each consultation, the cost is incurred by several people. So I would answer like in the different sectors. Yeah, the client who is paying 3,000 francs, just like you said, is buying data from a telecom company. He's not buying from Waspito, by the way. So that's a cost incurred by them. And it counts as well. So if they pay 3,000 francs to speak to the doctor, now that adds up to so they're spending more than 3,000 francs, maybe 3,100 francs to speak to a doctor. The cost, I think this is a business. We are a business, and we believe that just like any other business, before I continue my answer, I think like any other business, price is set by market forces. If you put your price at 20,000 francs per consultation, people will consult if the market forces dictate that price is okay, unless you are an absolute monopoly. If you put the price at 3,000 francs and that's probably too small, what will happen is you have a lot of calls that will force you to probably take the price up so that it can help you manage the load. So we think 3,000 francs is a sweet spot so far. When we started, we have fluctuated price a little bit, but based on the feedback, we think 3,000 francs is a sweet spot. Yes, doctors might earn more if they had a physical visit, but based on our current experience, we realize that the remote consultations are much, much shorter. And there is no time between one patient and another one. If there's time wasted between one patient and another, it's like 1 or 2 seconds while you switch calls. So personally, I think for generalist consultations, it has ranged between 6 minutes and 15 minutes. For specialist consultations, it has ranged from 8 minutes to about 16 minutes. That's like a good average. And we think that if you can do the math as a generalist, you can actually earn a salary by sitting at home and speaking to patients. And we think that on the patient side as well, yes, you're paying for data, but you're not traveling, you're not paying taxi fare. Even when it was free consultation in a clinic, you had to pay to go there. Yes, now you're no longer paying, you're no longer waiting to see the doctor, it's an instant consultation. So all these forces balance up, and we think 3,000 francs is a sweet spot for generalist consultation.
That's why you're a Mandela Washington Fellow. Thank you very much. And Brian, I rest my case.
Yeah, I remember, Elvis, you're one of the first Mandela Washington Fellows. So you guys are doing amazing. I'm really proud of you guys. Thanks a lot, Alexis, for that talk. I think it's, I think the whole, and I'm really proud of what you guys have started with Waspito in Cameroon. It kind of opens the framework to these conversations around digital health in general, and how we can advance that, you know, that landscape, particularly in Cameroon and in Africa. A few weeks back, we had a conversation here with Dr. Emmanuel Fombo, who is into, you know, he talked to us about the future of healthcare and the role that, you know, algorithms, you know, AI, artificial intelligence, and how that's paving the way for the future of healthcare in general. So I'm really, you know, looking forward to, you know, how this, you know, this expanding into, you know, other horizons and things like that. I just want to say, if there are people who have questions, you can raise your hand to contribute or to comment or to ask a question, or you can also drop the question in the chat. In the chat, there's Dr. Emmanuel Folak raised a very important question, which I really wanted you to talk about as well. Is this, when we talk about digital health, is this issue around confidentiality and HIPAA compliance systems? It was my first time hearing about the DHIS2 system that you talked about, the digital health surveillance system. So I'm wondering if you can talk a little bit more about how the systems operate, and if it's, I know we don't have a HIPAA compliant kind of framework in Cameroon, but how is that system HIPAA compliant? So I think Dr. Folak really wants to know if there's any kind of official regulation by the Cameroon National Medical Council on telemedicine in general.